Hello, and welcome to my podcast, Good Grief. My name is Dr. Christine Malone, and in this podcast, we talk about trauma, tragedy, and survival. In each episode, I will interview someone that has gone through grief in some way, and we will discuss the impact it has had on their life. By sharing these stories, we hope that others won't feel alone should they be going through similar situations. Enjoy. Okay, listeners, thank you so much for joining me for this podcast. My guest today is going to talk about his liver transplant survival journey. So, guest, if you would introduce yourself and tell us a bit about, how your journey has started with the liver transplant.
Sure. My name is John Hoffman. I'm 41 years old. My diagnosis was at 6 weeks old. I was a baby. Was biliary atresia, which affects 1 in 10 to 15,000 births in the U.S. So it's pretty rare, and they really don't have you know a source for it yet. They don't know what causes it. So it's diagnosed at 6 weeks. They do exploratory surgery to kind of you know first make sure that's what it is, and then the biggest option after that, before a transplant, is something called the Kasai procedure, where they go in and they remove or they try to remove the damaged bile ducts, and they replace it with pieces of the child's intestine, which it has a varying success rate. Unfortunately, my Kasai procedure did not work. It failed after not very long. So I was put on the list for a liver transplant, which I received January 14th of 1983. So I was 13 months old. Aside from taking anti-rejection medicines and some complications after transplant, I grew up as pretty much a normal kid. I love sports and just getting outside in general. The big difference with me from other kids was, first of all, I took quite a few medications. The anti-rejection drug back then for me was cyclosporin. It was kind of an olive oil consistency, if you will. And my mom used to mix it with apple juice or chocolate milk and give it to me in a shot glass. So it didn't dawn on me in the time, but when I look back on it, it's kind of funny.
So you
So, and then go ahead.
even any like physical things you couldn't do or anything like that, or
Yeah.
the only difference
Yeah. I mean,
medication.
I was told I couldn't do contact sports, which I wasn't really inclined to ever want to play, football or hockey, so that wasn't too big a deal. My heart was crushed when I was in second grade, and we had a class pet parakeet, and I was told by my liver doctor that I could absolutely not have one. So that was pretty devastating for me, but nothing major. Other than that, and I didn't really have any limitations.
Why couldn't you have the parakeet? Was it something like the bird?
Yeah, they carry some kind of diseases.
Okay. Yeah, all right.
That's very dangerous to immunocompromised patients.
Okay. Okay. Makes sense. So you went on for how many years with that first liver where everything was going,
Right.
hey, how did that all transpire?
Yeah, so I mean, overall, my liver numbers were good. I had some, elevation here and there, but nothing to be concerned about until fourth grade. So I was what, 10, and my numbers started to kind of shoot up, and that was the first sign of some trouble. I spent at least a week in the hospital, getting bolused with the anti-rejection medicine and this and that to bring that down. And that's when the rumblings kind of started about, yeah, you could possibly, it's not a definite yet, but you might possibly need another transplant. Which for me was kind of bizarre because I didn't experience the first one. So that was kind of an out there thing that, could happen. And then the next major occurrence was when I was in seventh grade, when I was in junior high. And again, I got some jaundice. I didn't I didn't feel really bad. I just knew that something was not right. And again, my liver numbers shot up. I spent some time in the hospital. And that's when the conversations really got serious. Freshman year of high school, I flew to Pittsburgh for a transplant evaluation. So that's when everything kind of became real. Um, they did a great job of explaining, what to expect. They had slideshows of the different tubes and things I'd be hooked up with, what kind of medicines I'd be taking afterwards. So it was a real reality check. Because I was of a certain age and could understand what was going on, I actually had to sign uh, a compliance form, something that says, hey, this is your chance. If you damage this liver, you're not getting another one, to that effect. So again, that was something very serious and kind of jolted me. Um,
So
so
did they give you a list of what things you would damage the liver? I mean, I'm thinking of things that I know.
yeah, it was more like, heavy drinking, smoking, things like that. Things that, would have an obvious effect on your body and more specifically the liver. So
Uh,
I honestly couldn't remember, but I got the gist.
yeah. So I mean, when they say to you, if you break these rules and it doesn't work out, you can't be on the transplant list again. I mean, did they really mean?
Yeah, I think yeah, I mean, again, I couldn't tell you if it was black and white or not, but it was certainly a pretty stern warning. I don't know what the rules are, regarding this. I mean, I'm sure it happens, but it certainly makes it a lot harder to get on the list and get a transplant.
Well, it makes sense, and I don't know the numbers. You probably do of how many people are on the transplant list and how many livers come available. So, obviously, healthcare professionals want to make sure that those people who are going to
Absolutely.
have the best outcome are be the ones we give these organs to. So,
Well, yeah, and there weren't any living donors yet. So, it was something that, someone had to be sacrificed in order to do it. So you
right,
wanted to make sure you were, quote unquote worthy
right.
for it.
No, excellent point. Excellent point. So you got the second transplant. You're in high school.
Yeah, it was my summer before my senior year. So it was July 1st of 99. I was a musician. So my big goal was I wanted to get ready for band practice in late August. So that was kind of my driving force. I wanted to get back on the field. I wanted to see, I was very different than what I am today. I did not want to share a lot of information. I didn't want kids to know that he's got a bum liver or, he takes a lot of medication or whatever. I didn't want to be defined by that. I just kind of wanted to blend in and be one of the guys and one of the students and just move about my life. So
I think that's pretty darn normal for a high school kid for sure. I mean,
yeah, I mean that could be the case with anybody, really.
you don't want to stand out as being different
Right.
from someone else over
Exactly.
time. So yeah, no, that's so you still have that liver, I'm assuming, and everything's
Yes.
going well.
Yes, everything's great. The big concern with immunosuppressants, specifically liver anti-rejection medicines, is damage to the kidneys.
Uh,
So they keep a very close watch on my levels, how much I'm taking, how much it's called tacrolimus or Prograf, how much is in the blood and how much is. So I also see a kidney specialist to make sure we're on top of that. And I take pretty much the lowest dose you can. I take 1 milligram twice a day. So it's pretty much as low as it can be. I mean, if I get blood work and the tacrolimus level is a little low, they might increase it a tad. They just kind of play with it a little bit. But luckily, I haven't had a change in a while. So
yeah. So basically, your life is not much different than any other person, other than you take a medication a couple times.
correct.
Yeah.
Right.
And
Yep.
and your limitations aren't really, I mean, obviously we don't become a heavy drinker, but
Right.
other than that, not really any physical limitations that you have
Right.
on that level. So that
Well,
sounds like
and the drinking thing was a big deal when I was in high school and I was in college because that's what
um,
everybody was doing, and there was that. Nobody tried to force it on me, but it was just the peer pressure that I couldn't do it, and
and you
I
didn't want
again felt kind of like an outcast in that
yeah,
way.
and you didn't want to tell them why because you didn't want to tell them your whole story. So
Right.
like,
Exactly.
yeah, no, I hear that from that perspective, that's for sure. So
Yeah.
So, as you've obviously gotten from high school to where you are now, what, is there anything different about your life that you think is, you've given up something or you've lost out on something, anything like that?
Well, let me tell you, for a high school kid supposed to be getting ready for college, it was certainly a very large distraction. So I did not, I did not, I wasn't prepared for the college experience. I never picked a major. I fought it the whole way, filling out the financial aid packets and all that kind of stuff. So, I was heading toward this roadblock, and I never actually looked on the other side. So, I got my transplant. I'm healthier than I've ever been in my life, but I didn't really have any direction. And that's kind of where the struggle started. Somebody gave their life for me, and here I am. I have no idea what I'm doing with my life, and I spent a semester and a half in college and dropped out because I just had no idea what I was doing. I felt so different from everybody, and I got diagnosed with depression. And I started seeing a therapist, and eventually, learned to love myself and to move on and get a job and have a family. But that's kind of, I don't want to say plagued me, but that's certainly been something I carried ever since. And I always feel guilty again for because certainly the donor families gave up a lot more, and their struggle obviously is real and it's very traumatic. But at the same time, there's something to be said about survivor's guilt, and that's definitely what what led to the depression and other things.
That actually is an excellent point I had never thought of. I know
Yeah.
those of us who've survived other things in life where we survived and someone else didn't,
Hmm.
definitely built some of that guilt. I haven't really thought about for someone who receives a organ from someone who died and
Hmm.
they donated. I can imagine the families though feel some solace in that their loved
Hmm.
ones living on and helping someone else living
Right.
on. I would assume that
Well,
that's
yeah, and actually, when we were waiting for my second transplant, we had gotten there. I gotten my Johnny. I did all that. The donor's family actually peeked in and got to see, who was getting the liver and that kind of thing. So they had a face to go with the recipient. Um, and back to the point about, the guilt. Add on top of that the fact that I wasn't talking to anybody about it, not even my parents really. And there was no social media. You couldn't talk to other people that went through the same kind of stuff. So that just kind of compiled everything.
yeah. Do you have any other further contact with that family at all since then?
No, no, they told me that I could send the hospital a letter and then they would get it to the donor. But again, I didn't want to think about it. I wanted to move on, and
Right.
sadly, I never really
Yeah,
gave it a thought. And thinking about it now, I would have loved to do something like that.
yeah. No, I'm just thinking if I was having lost a child, I'm thinking
Oh,
how
absolutely.
how amazing it would be to be thinking what
Yeah.
part of them is living on and someone else would be pretty darned amazing.
Absolutely. And you
Yeah.
see these stories now of recipients meeting the donor family and how neat that is. And
Oh, I
you
know.
never know. I mean, I do have a book and I do have a website. Who knows? Maybe somebody will find me and they'll know. I don't know if they even knew my name at the time.
Right.
I have no idea. But you never know.
Well, you never know. They might know the dates and so on.
Sure.
So,
Sure.
for sure. So tell us about your book. So what inspired you to write the book to begin with, and what's in your book, and what who is your audience, and so on.
Well, it didn't come about till I was an adult. And again, compiling the guilt and the trying to figure out how can I give back? How can I honor this gift and this family? And at the time, I was listening to a lot of audiobooks, and that was just the thing I was into. And then I said, you know what? This would make a book, and I could tell my story, and I could, it's obviously targeted at either transplant recipients, potential donors, people that are on one side or the other living with this kind of event. So that was kind of my target. It was in 2016, I started, kind of getting an idea of what I wanted to do. And I didn't release it till 2021. So it took a long time, a lot of interviews with family members. At the time, I actually got a job working at the Children's Hospital where my gastroenterologist, my liver doctor, still works to this day. So there were a lot of people. I always tell this story. I went in with my manager to kind of get a look around at the IT side of the hospital because I already knew, the hospital. And he brought me into one of the morning huddles, the morning meetings. and he was introducing me, and no lie, there was a gasp on the other side of the room. And she said, "I was your dietitian when I was a baby." So that was really cool. So I got to interview her and a couple other nurses that were taking care of me when I was a baby. So that just further confirmed that this is what I need to do.
Well, that's really cool. I love that story.
It was amazing.
Yeah, so the basis of the book is your story, and then
Right.
you include other stories in there from other people who have done transplants, or is it just your story in there?
Yeah, I mean, it's my story from a lot of different perspectives. My parents, my
Uh,
family members. I actually got to have an interview with one of the surgeons who performed the transplant, my second transplant. Um, so you got kind of a medical side, you got the emotional side, and it was really great how it all came together. I did a GoFundMe to try to raise money to get the book made. Um, but yeah, I mean, there's no dramatization. I mean, everything in there. I had been hearing these stories from my mom mostly, but my aunts and uncles at things that happened when I was a baby and so on. And now I had this opportunity to kind of put it all together in one place, which was really cool.
yeah, I would imagine so. Have you received any emails, contact, feedback, whatever from anybody who's read the book? Um,
Yeah.
yeah, so tell us about that.
Yeah, either through the contact me section on the website, or I've been in, well, obviously I was promoting it pretty heavily when I was releasing it, and some of these Facebook groups with biliary tree or liver transplant survivors or people waiting, they said, "Oh, I bought one, I loved it," things like that. I got a lot of comments like that, which was pretty neat.
Kind of gives you that sense of purpose for the work you
Absolutely.
do. Not only that, but telling your story. So I'm curious if you, I mean, the baby having the transplant in your baby, obviously you don't have any feedback on that, but
Hmm.
if you were talking to someone who's facing, a diagnosis that's going to cause them to need an organ transplant,
Hmm.
what would you say as far as what use this support group, look into
Hmm.
this, don't do this, whatever. What advice might you be able to share?
Well, I mean, first of all, they're at the best possible place for transplantation and organ donation. I mean, living donors, partial liver trans or partial organ I mean, the list goes on and on. So, take comfort in the fact that the science is working for you, and the percentages are excellent, and the care is great. So that's first of all. Um, I just searched on Facebook for transplant survivors, and it's not just liver. I mean, there's lung transplant, heart transplant, kidney transplant. So it's just a multitude of support and sources to get information, to get you know friendship and camaraderie and things like that. And then lastly, I mean, you still got to live. You still got to get up every day and find the best in your life and live it. I mean,
Yeah.
most likely you're going to survive and your life is going to continue. So you got to make sure that you're doing everything you can to be the best possible person before and after.
Yeah, well, it makes perfect sense. So I'm curious. I'm guessing you and your mom have, or your parents have talked about kind of when you were a baby and going through
Hmm.
this. Was there anything that kind of comes to mind that your parents have shared that, gosh, if I'd known this, we would have done this sooner, or we could have done this, or whatever. I'm just curious. As a parent myself, how do parents survive this when it's their baby who,
Yeah.
needs this life-saving major surgery to, keep going?
Well, I mean, they were so young when, and transplantation was still experimental. So there was so much unknown, and there weren't any support groups. So I
Mm,
think they did the best they could. I mean, it was very lonely for them. I mean, obviously when you go to Pittsburgh, there's other families waiting for transplants, but a lot of those kids were a lot sicker than me. And it was, I mean, I think my mom went to a few support groups and she was just sad. It was just really hard to even get through because of all the trauma and the death, and so it was really hard. I don't think there was anything they could have done differently. I mean, they caught it really early. You know, they knew I wasn't gaining weight, took me to the primary, who then referred me to my liver doctor, and things continued from there. I don't think they have any regrets in that capacity. Other
Yeah.
than probably, I mean, nowadays you press the doctor for information and they'll give it to you. Back then, I don't know how much you know about the world of transplantation, but my first transplant was performed by Dr. Starzl, Thomas Starzl. He's pretty much known as the father of transplantation. He developed a lot of techniques. He was very, very involved in the development of cyclosporin, the first kind of wonder drug for immunosuppression. And he had a very abrupt manner. He'd come in, he'd look at me, he'd do the various, vitals tests, and then he'd leave. That was it. There wasn't much communication. So that was really hard. I mean, they knew they were in good hands, but there was no bedside manner happening.
Um, Well, that's pre-internet,
Exactly.
all that. I know for me, when my middle son was diagnosed with a very devastating diagnosis after he was born, I was
Mhm.
able to find support groups online of other
Oh
parents
yeah.
with the same thing, and that was very, very helpful to me as a parent to find other parents who are in the same boat, and I don't feel alone. And I'm a big supporter of support groups for that
Yeah,
purpose.
and you're able to ask the right questions when it comes time for for
It's
their
like,
procedures and things like
exactly.
that. Yeah.
Exactly. It's like, well, how did you deal with this and how did you deal with that? And to not feel not necessarily just alone, but not to feel like an outsider or a freak, a one-off. It's like, okay, there's other parents out here who are dealing
Yeah.
with the same thing, which especially as you mentioned, your parents were young, extremely scary for that.
Mhm.
So yeah, I can imagine the pain that they and the scariness they went through.
And
So
there were no beds in hospital rooms for they to sleep in, so they went
oh,
home every night, and they didn't know what would happen when they came in the morning.
oh my
There were times I'd get pneumonia or something, or they'd come in and I'd be gone getting some kind of a test, and
oh gosh.
yeah, it's a totally different world now.
It is, and yet still that
Oh yeah, there's still that unknown, absolutely.
that's
Yep,
still a part of the unknown, especially when it's your baby and a tiny little baby,
absolutely.
13 months getting a liver transplant is
Hmm.
a big deal. So tell me
Absolutely.
about your website and your blog. So you have the website and the blog, and what do you do on there? What kind of stuff do you post on there? What who do you focus to?
Yeah, I started with I built the website. I started with the blog, the year or so leading up to the actual book release when I was writing it. I took stories like I told you from, my parents and from other things and wrote little blog posts about them. Um, for instance, one of them was when we actually got the call and you know, uh, this is my second transplant, and they had chartered a flight, and we got on the tarmac, and an ambulance roared up, and I was able to walk out of the plane and carry my own bag, and they raced with the gurney up to the plane and said, "Well, where's the patient?" And I kind of said, "I'm right here." They said, "Well, we were expecting someone a lot sicker." Little did they know that I was that sick, but I didn't carry myself that way. So things like that, and just little anecdotes here and there that people can, maybe chuckle at, maybe, identify with, and things like that. So that was kind of the goal in the beginning.
I love your comment about chuckle acts. I know for me, kind of making light or having some humor in some of these things. It's like, what, that's what life is. And,
Hmm.
these things happen. And if we can't look at it with a little bit of humor, um, that's a problem. So no, I appreciate that.
Well,
So
let me tell you, my mom and I, we've developed a great bond because we spent a lot of time. I mean, not to discount my dad, he did also, but during the day when I was bored, and humor was our medicine. I mean,
yeah,
there were just a lot of things. Like for instance, the hospital TVs had what, maybe six channels, and one of them was a movie channel, and it showed, I don't know if you've heard of The Green Card,
yes,
the movie,
yes.
over and over and over. We must have watched that thing like 8 times, and something like that you remember and you laugh at even now.
Yeah, yeah, for sure. So I think you and your mom are probably pretty close then, is what I'm
Yes,
hearing then.
absolutely.
That's great. So do you know? I mean, what are the odds that you'll need another liver transplant at some point in time, or is there really no thought about that? I mean, we don't even know.
No, I mean, I've been told that, this one should be good, and my blood work and my visits with my doctor say the same thing. So I don't anticipate it, but I guess you never know.
You never know. The purpose is to stay positive. And
Exactly.
yeah, exactly. So is there anything else you'd like to share with our listeners about your journey or advice or whatever you'd like to share before we go?
I don't think so. I mean, I've been doing some work with the American Liver Foundation, so that's a big deal for me. I'm part of the advocacy team, which is made up of patients and doctors and
Right.
prospective transplant recipients. So that's a really neat thing. So
I think that's
people
great.
should check that out, their campaigns and what they can do to help.
Yeah, so when your episode airs, we're definitely going to want to post some links to all that kind of information that you would like to share for anyone who's not only in your situation, but maybe they have their family member is or their coworker is. They just want to
Mhm.
know more about how do I support this person or what should I say or not say, and that kind of thing. So, I think
Right.
a lot of times people when they're around someone who's dealing with a diagnosis that's kind of a got to live with this thing, got to survive with this thing,
Mhm.
we don't know what to say or what to do, and so we don't say anything, and that
Right.
can be even more of a problem. It's like, no, just what might you say, what might you do, and so I think some of those links can help people really kind of grasp
Yeah,
what.
and on that fact, I mean, picture me as a teenager and having teenage friends, and
Yeah,
what do they do? And the
yeah,
best thing they did was to treat me like any other person. It was
yeah,
never really a topic of conversation. It was just,
yeah,
and I still have the same friends now. So,
yeah.
and one of my friends was my girlfriend, and we're
Yeah,
married
there
now,
you go.
and we
I'm
have
gonna
three
bet,
kids.
yeah, I'm gonna
So,
bet the same is probably true for your parents, is treat you like any other normal kid and not
yep,
treat
they did. They
kid go
did.
on
And even when
horrible.
I was really, really sick, when I was, in high school, coming home and taking a nap every day after school and waking up for dinner, I mean, they didn't let on how concerned they were, but they obviously shared with me how worried
Yeah,
they were.
but to treat you as a quote unquote normal kid who's got
Right.
chores or whatever else to do,
And
uh,
have me experience everything that
yes,
a normal kid would. Yeah,
yeah, which is wonderful. I mean, obviously it gets you to where you are today, which is
exactly.
yeah, fabulous. All right. Well, John, thank you so much for your time. I really appreciate you sharing your story.
Thank
As
you.
I mentioned, we will post some links to your blog and your book and so on when your episode airs, and I really appreciate your time.
Thank you very much.
Thank you for listening to this episode of Good Grief. To hear more about my personal story, please pick up a copy of my book, The Day I Became the Spider Killer, a memoir of trauma, tragedy, and survival, available in paperback, Kindle, and Audible via Amazon, Barnes& and Noble, and other online book retailers.